Good morning, good afternoon, good evening, everybody, depending on where you are. It is a pleasure and a privilege to welcome Professor Manjunath Sharma ji to this talk, for his talk. As all of you know, Professor Manjunath Sharma ji needs no introduction. He is world famous. He's known all over the world. But just for the sake of this program, it's as part of the protocol, I'm forced to do it. Dr. Manjunath NK is a prominent figure in the field of yoga and naturopathy. He is the current Vice Chancellor of SVSI University. He holds a bachelor degree in naturopathy and yogic sciences from Mangalore University and earned his PhD in yoga and geriatric medicine from SVSI University. In recognition of his significant contribution to yoga research, SVSI conferred upon him esteemed DSc, honoris causa. With the illustrious career spanning over 30 years in academia, research, and administration, Dr. Sharma has made remarkable contribution in the field. He has published 84 research papers in international journal, indexed in leading bibliographic databases. His diverse research interests include the psychophysiology of yoga, neural correlates of meditation, aging, and rehabilitation. Additionally, he has been successfully guiding numerous students pursuing their PhDs, MDs, and MSc programs for a span of over 3 decades. As the editor of the very famed International Journal of Yoga, that's iJoy in short, and a reviewer for various prestigious international journals, Dr. Manjunath plays a pivotal role in advancing evidence-based yoga research. He has delivered lectures and conducted workshops on yoga therapy at globally renowned institutions, including the Harvard Medical School, Monash University, the Royal College of Medicine, Shanghai University of Sports, and the Pharma University. Dr. Manjunath's influence exists beyond academia, and he spends a considerable time in an advisory role, advising the government of India and multiple other institutions based on his massive knowledge and personal experience in the field of yoga, academia, and naturopathy. He is a member of several key committees, including the Scientific Advisory Committee, Department of Science and Technology, Government of India, the Research Advisory Committee, Integrative Medicine, Niti Aayog, the Core Committee of Yoga Accreditation in Higher Education, NAC, the Government of India, and the Steering Committee, Yoga Programs and Accreditation, Yunnan Minzu University in China. In addition to his advisory role, Dr. Manjunath holds prominent leadership position as the Vice President of Vivekananda Yoga University, which you guys know is the first yoga university in the US, very acclaimed for their courses. Actually, Dr. Manjunath is the brain behind setting up such universities here in the US. He's also the Vice President of Asian Yoga Therapy Association, Singapore. He is also the founding director of Vivekananda Health Global, a global network of integrative medicine clinics and hospitals. Dr. Manjunath's exceptional achievement has been recognized with numerous prestigious awards, including the Bharat Gaurav Award at the House of Commons, British Parliament, London, and the IASTAM Yoga Forum, Munich, Patanjali Award for his excellence in interdisciplinary development. It is my pride and privilege, not only despite his super illustrious career, he's a very nice gentleman, lives with his wife and son in Bangalore. So it's all yours, Dr. Manjunath ji. It's really proud and it's my privilege to have you at this forum today.
Thank you and namaste to everyone. Indranil ji, you are running this series, and I was always thinking who is the best person to bring this into mainstream, and there is none other than there is one Indranil Basu Reji. So we are grateful to you from the community of traditional medicine and integrative medicine for taking this leadership role and bringing this whole knowledge base, and also getting such amazing experts in the field of integrative medicine under one platform, and really grateful to you, also to the American Academy of Yoga in Medicine. So today I'll be just spending a couple of minutes in the next hour looking at various dimensions of integrative medicine, but focusing on the key concepts and approaches. And I'm also going to, because my whole journey has been connected with yoga research, I will use yoga research as one of the tools of creating that integrative medical research approach, whereby we can take it forward with other systems of medicine. I'm going to just share my slides. Is this clear and visible?
Yeah, it's absolutely clear. Very beautiful slide.
Thank you. Thank you very much. So Indraneelji always keeps talking about mainstreaming traditional medicine, bringing traditional medicine as part of this whole mission of integrative medicine, and research plays an important role in this. When we look at this whole aspect of integrative medicine, we know very well, many speakers might have spoken already. We keep on hearing or listening to these three terminologies: complementary medicine, alternative medicine, and integrative medicine. So complementary is the one which is used together with conventional medicine, while alternative is the one which is used in place of an established system of medicine, while integrative medicine combines the mainstream medical therapies and the complementary and alternative therapies based on high quality scientific evidence, particularly looking at safety and effectiveness. When you look at the right side of it, there are multiple approaches people use. It is not limited to what is mentioned over here. It is a gamut of interventions which we use under this domain of integrative medicine, which includes lifestyle to begin with, mind-body intervention, to energy medicine, manipulative therapies, as well as herbal medicine and nutrition as a system to deal with, along with the conventional medicine, which includes pharmaceutical approaches as well as surgical interventions. If you look at the clinical evidence for the use of Ayush systems or the tradition in comparison with the traditional Chinese medicine, the figures, particularly I have highlighted Chinese medicine. All of us, those who are working in the domain of traditional medicine, should take note of this fact that if traditional Chinese medicine is becoming more and more acceptable, or rather already acceptable in various countries outside China, it is purely because of these staggering figures, what you see with 422,000 publications related to this. I mean, this I have picked from the PubMed as on today. When you compare this with various other Ayush systems in India, Ayurveda, then Unani, Siddha medicine, and homeopathy, you can see the numbers as it's good to have these numbers, but we are nowhere to say that we have enough evidence for its use, or it is little far away to say that we are in the process of mainstreaming these activities as a system of medicine. But there is so much to pick from its ancient glory, because that's where we get hints for our research, which can be utilized for subsequently making it as an evidence-based science. If you pick the information, just using these terminologies, complementary medicine, integrative medicine, etc., there is huge amount of literature available. For example, like 324,000 articles on complementary medicine. This includes anything and everything which is covered under complementary medicine, while integrative medicine is probably the numbers may be a little smaller where the keyword integrative medicine is used, but otherwise most of that, whatever has been covered in complementary medicine, is certainly involved or included in integrative medicine. The sad part, I am putting it as the number of randomized controlled trials which are used with the terminology integrative medicine. Unfortunately, not many. We have a long way to go, as I mentioned. But there are attempts which are being made on putting together this information as systematic reviews and meta-analysis, which is very essential. Otherwise, we keep duplicating, or we keep looking at the same area without emphasizing on the existing knowledge and also giving a direction. There are a decent amount of publications combined together as meta-analysis and systematic reviews, while there are majority of the studies where an intervention is used as a single group as part of the design, which is once again as a part of the limitation of these studies which we are going to see. When you look at the key concepts used in integrative medicine, one fundamental concept which binds all this together is the holistic approach. Okay, so where an individual is treated as a complete system, not divided into systems and symptoms. So apart from that, we are also interested in looking at integrative medicine, not just to make an individual who is having an health issue healthy, but also to prevent. So preventive healthcare strategy is one of the very essential component or the concept used in integrative medicine, along with personalized medicine. So each individual is different. The concepts in yoga, Ayurveda, and multiple other systems of Ayush always look at identifying individual differences in creating clinical protocols. There is a challenge when we pick this personalized approach, that how do you generalize? So probably with the development of technology today, which I don't shy away in using at any stage, we use either artificial intelligence or whatever it is, a trend or a pattern is going to emerge with as many combinations we can look at as personalized approaches, which can subsequently help in developing this as a system. We also look at the causal relationship with a disease condition rather than looking at a symptomatic approach, and using natural remedies as the primary focus rather than using any interventions which are artificial, or rather which body is not going to accept. And the main focus is also on mind-body medicine. We have multiple interventions which are brought under mind-body medicine, which are all under this domain of evidence-based approach. One thing which comes again and again, whenever we talk of bringing traditional medicine into integrative medicine, we have to keep this concept of culture-specific approach in mind, which otherwise limits our, even if we do a scientific study in India or any other country, can you really generalize it to the population in America or in China becomes an issue. Why we talk about generating more evidence? Certainly, as I mentioned in the previous slide, that traditional Chinese medicine, of course, one of the component of traditional Chinese medicine, which is acupuncture, has become the most acceptable form of complementary and integrative medicine today. While yoga therapy has become the best adjuvant in integrative medicine. So if you want to use something along with an existing or well-established system of medicine, yoga therapy is the choice of such intervention. If you look at yoga therapy and particularly focusing on research component of it, the journey has not started. I'm picking only the modern medical research connected with yoga therapy. So we can look back over 100 years. Otherwise, we are used to telling that yoga therapy is 5,000 year old. Yes, there are so many things to pick from those 5,000 years of experience, but how do you convert it into an evidence-based science, you can pull back to around 100 years of this journey. Started with curiosity, somebody telling that there are exceptional feats possible with the practice of yoga, either a meditator or a great yoga master demonstrating that, yes, I can voluntarily regulate my involuntary functions, or I can bring in autonomic disparity at will. So whatever has been the claim, that created a curiosity. And second thing is health benefits of yoga. So many individuals who practiced yoga started giving their anecdotal references, saying that I started practicing yoga, I started feeling better. I had an health issue, it disappeared because I started practicing yoga. There was no evidence, but it has started with the definition of individuals talking about health benefits. Present day, the yoga research has moved quite ahead. So we have evidences coming out of physiological studies on one side to molecular mechanisms on the other side, neuroscience related studies to studies on high states of consciousness. So we have a gamut of areas which are being covered under this. Why do we really look at yoga research? Certainly when people talk about 5,000 years, etc., the concept of experiential science versus experimental science comes for a discussion. Many people say that, oh dear, yoga has to be experienced, not to be experimented. But there are so many great yoga masters who volunteered themselves for such experiment, because of which today we proudly say that, yes, yoga can produce these kind of changes physiologically, as well as even today when you look at the level of neural plasticity. So what we are doing is complementing the tradition with evidence. When you look at yoga research or integrative medicine research in particular, 4 verticals emerge. One is literary research. Literary research here, I mean, be it Ayurveda, yoga, or Siddha medicine, Sawaringpa, or you are looking at Unani medicine, or as well as homeopathy for that matter, there's so much of textual references which talk about the causation of a health problem as well as the remedial measures. So if we can understand them and try to look at the modern methods of really demonstrating the same with process, then probably we will be in a better position to ask research questions. Of course, having knowledge of both basic research as well as clinical research is going to help us in taking this in a direction which will be acceptable. Finally, the goal is, even though we do clinical research at 4 levels, the goal is to bring it into an application. Can I transform society with a requirement as per the health benefits or as per an individual need? There are a couple of challenges and advantages. So we always look at certain challenges. The methodology is certainly dominated by modern medicine. Nothing wrong in it, because it is an established system of science or medical science. So if we want to, many people comment on it very easily that, oh, it's not possible to do yoga-based research using randomized controlled trial, or bringing Ayurveda for randomized controlled trial when you are using various other therapies other than pharmaceutical approach. Questioning is very easy. What is the solution is what we are looking at. Why not bring in a methodology which fits into modern medical approach, but modified to suit the traditional and integrative approach? There is certainly a lack of evidence in traditional medicine, which is a challenge even to submit a clinical proposal for research funding today. When I submit a proposal, then somebody says that, no, you are bringing in an intervention which we cannot risk at this stage for implementing in patients. Ethical considerations come very strongly as an issue. Also, developing and validating clinical protocols, bringing multiple systems together is an issue. But this should not become a limitation. There is a way forward whereby we understand multiple components of it. So the lack of clinical setting for integrative medicine research, many of us want to do integrative medicine research. Where do you have a clinical setting where you can give these kind of interventions for patients whereby you can do research? So these are some challenges what we have, but thanks to many institutions who have taken the lead, hats off to many of the Western universities where they have adopted integrative medicine methodology or clinical setting, whereby they are bringing and are giving an opportunity for research. While advantages remain, as we always say, that there is a huge scope for developing new methodologies. When there are limitations, we should always convert them into opportunities. One of the standard protocol used in yoga research was reverse pharmacology approach. I mean, you camp to laboratory kind of a research rather than laboratory to a camp kind of a research. And also there is a huge scope for integrating best of interventions together in this. Just I want to give this as a case study for those who are interested, how this whole process has been converted. And today it has been made as integrative medical approach. That's why I call it as translating research into clinical practice. So the whole idea of bringing yoga as an adjuvant therapy. So in none of these studies, it is yoga has never been used as a standalone therapy. So that's why I proudly say, or with a lot of confidence, I can say that yoga is probably the best adjuvant in clinical management. So probably you can look at those 800 plus publications from this one institute. And of course, now considering few other publications coming out of these fields, whatever has been mentioned here, crossing 1,000 plus publications. And when you look at these contributions, like I mentioned, there is basic research which is very essential before we jump on to clinical research. Understand what exactly happens when you give any of the interventions or use it in a condition which is not going to get manipulated because of the intervention. So we have done series of studies. At least in basic research, around 35% of our publication come on research on children, 15% of publication coming from elderly, and 50% of our publication coming from middle-aged. When you see the areas which we have looked upon, talk about its applications. It's always important, number one, to look at the area of application, number two, to look at the intervention part of it. So when you see physical postures, voluntarily regulated breathing, meditation, or relaxation response, all of them can contribute either in isolation or in combination. Major contributions to clinical research come from non-communicable diseases. So 50% of our publications come from non-communicable diseases. 3 of them I have highlighted here: bronchial asthma, type 2 diabetes, as well as cancer, oncology. Whereas women health is another area, 20% of publication where perimenopausal or as well as polycystic ovarian disease are some of those where we have more publications. Pain management, particularly back pain and migraine, while rehabilitation is also equally good contributor, including cardiac rehab, neuro rehab, and psychiatric. At SVIASA, you need, we have multiple laboratories to attend to these requirements. So why we have these multiple laboratories? Probably once again to integrate. Many times we do research in isolation. Somebody doing a research on oxidative stress, while other one is doing on heart rate variability, a third one doing on neural plasticity, a fourth one doing on psychology. What happens? Who is going to put them together? When you put them together in different population, is it going to produce the same result? So that's when you need to really pick those important variables which can answer your questions and probably give a better communication. When you look at basic research, what has emerged in yoga research is a new design, research methodology, which is used commonly called as self as control design. Of course, otherwise, we also do lots of studies using matched control trials, etc. in basic research. I'm talking about, imagine I want to study the effect of a particular asana, pranayama, meditation, or a relaxation response. How do I study it? Same individual studied across multiple sessions on different occasions. For example, today I study an individual doing right nostril breathing. Tomorrow, at the same time, under similar conditions, I do the left nostril breathing. A third day, alternate nostril breathing. A fourth day, a control session like breath awareness. So that's what is going to give you physiologically comparable subjects. Otherwise, we do have this kind of an issue. The baseline comparisons itself will become an issue sometimes. You look at the sample size. When I picked multiple studies, the average sample size is actually quite smaller. Okay, so average sample size. I've also compared this with multiple other studies looking at physiological responses to yoga techniques. And majority of the studies have looked at male as subjects. I'm mentioning this to overcome the limitations. Tomorrow, if you really want to generalize these results, you have to fill these gaps. Otherwise, our results will not be accepted. So the duration is another important factor. Majority of the people have looked at immediate effect. Like they have done any meditation, before and after meditation, you check what happens and they have reported. Very few studies, they have looked at longitudinal changes. For example, you can see a 1 to 3 months is the maximum period of majority of the studies. I was interested at, are there any studies with 3 years to 5 years or 20 years of experience where we have looked at before and after? Even such studies are cross-sectional studies. An individual with 30 years of meditation experience compared with an age and gender matched, etc., with individuals. It's not a longitudinal study. Multiple variables have been studied, but the publications always talk how much we can look at. If you really want to study any practice for that matter, be it a asana, this is a very classical practice called Shirshasana. Anyone wants to do yoga at one point of time, they want to stand upside down because this is the king of all practices, what we call it as. So we have looked at multiple physiological responses. Why I'm talking about asanas, pranayama, meditation under basic research is really it is important to understand various components attached with your physiological responses. Shirshasana is one practice we actually contraindicate in many conditions. We don't advise this practice for patients due to several reasons, including patients with cardiorespiratory issues. Now, there was a guy who was doing Shirshasana, and he was our student, Bachelor of Science in Yoga. And this guy was, I don't know, fascinated or mad with this particular practice called Shirshasana, and he started doing it, and he used to remain in Shirshasana for 30 minutes. So then I said that, okay, it's interesting to study this guy. And then this guy started increasing the duration, and he started staying in one particular practice, Shirshasana, for as long as 2 to 2.5 hours. Seriously, I had the concern, is it safe for an individual to remain in an inverted posture for so long? These are the kind of questions which will help you. Number one, immediate effect. Okay, we know the classical responses, autonomic response, either an head down tilt or an head up tilt. What exactly happens? We know there is a particular way the autonomic system responds to your physiological stress. So, be it an asana or few pranayama practices, as you can see here, have specific signature effects, physiological responses. What you see here are right nostril and left nostril breathing. Of course, we always comment on saying that yoga practitioners make too much about this nostril breathing, though the difference is only 2.5 inches of nasal septum, which divides the nose, beyond which air enters into the same passage. In spite of everything, there are signature effects, right nostril breathing demonstrating sort of stimulating physiological response compared to left nostril breathing. Similarly, when you look at the electrophysiology, okay, what exactly happens in the brain when you do this right nostril and left nostril breathing? This question was asked because we all have this curiosity. Right nostril influences ipsilateral, or bring in ipsilateral changes or contralateral changes. Same side of the hemisphere gets affected, or opposite side of the hemisphere gets affected. It was quite interesting. It is not conclusive. Don't take that these studies are going to demonstrate what we wanted. So interesting fact was, when we looked at electrophysiology, there was certainly a kind of same side of the brain which is getting influenced. While when you look at the blood flow changes using functional near-infrared spectroscopy, this demonstrated contralateral. I mean, this is probably giving some kind of a input for us to explore more, because it is not conclusive. So many studies were done, and each one has its own signature. Probably these kind of studies are going to tell us, give us an idea for an application in future. We also look at the blood flow changes, particularly the blood flow to the brain using transcranial Doppler. When you really want to understand, is there an impact of either practice which, like Bastrika, which induces high frequency yoga breathing technique, which induces something similar to hyperventilation. Does it have an impact compared to a breath holding practice, Kumbhaka? So certainly each one of them once again have their signature. I have picked these two just to demonstrate. See, when you do fast breathing versus breath holding, both of them demonstrate opposite kind of results. This is where the application part of it comes. None of us use Kumbhaka in our yoga as part of yoga therapy. So probably there is something more to explore in Kumbhaka-based practices, and use them understanding the safety associated with breath holding, and then probably we'll have better impact on that. So these are just some results to demonstrate. While the last practice for basic research is meditation. All are interested to understand what exactly happens when you do meditation. There are hundreds of different techniques of meditation. And I am sitting here today with one of the greatest meditation practitioner on one side, meditation researcher on the other side. AAYM was standing, the M was standing for meditation earlier, which has been converted into yoga and medicine. But meditation is the heart of this whole movement, as I know what Indranil Basu ji wanted to bring it. When you look at these various types of meditation, there are commonalities and there are special differences. Probably that's what we need to understand. Understand the differences, then it will help you to use in a particular clinical condition better than the other one. Because otherwise, where do individuals know, or patients know which meditation technique to use? That's where research comes very handy for clinical practitioner to put them together. Of course, in yoga, we talk about phases of meditation: chanchalata, ekagrata, dharana, dhyana. Any meditation technique you see, it goes through the same methodology, and each one has, once again, a signature effect physiologically, some impacting a part of the brain, either brainstem, some impacting the central processing unit of the brain, while some impacting the association cortices. So this is a summary of various studies on meditation, and this is very interesting to demonstrate that probably, once again, while deciding which part of the brain I want to really have an impact, either have a stimulating effect or an activation, or bring in an inhibition, you can certainly do it. Can you also impact the cognition? Because aging associated cognitive defect or various other health related, including diabetes, can have an impact on cognition, can be modified or can be impacted through the practice of yoga. These are some of them on looking at the impact of meditation. Once again, as I was mentioning, the blood flow changes. Blood flow changes have its own signature on the opposite side of the brain, as I mentioned. Lots of studies are going on at present looking at specific parts of the brain getting impacted. All these are very important as part of our basic research, because if you can look at what exactly happens to the brain, either at the when you are going through different phases of meditation, or when you compare it with before and after with other types of meditation, you will get once again a very good clue that meditation brings in global inhibition as a common result, while specific meditation techniques can impact or activate specific areas of the brain. One thing very common, I mean, I have looked at multiple studies, the areas which regulate attentional processes, be it dorsolateral prefrontal cortex, anterior cingulate 2, areas which regulate emotion. Okay, so your limbic cortex are the ones which definitely going to get an impact. Yoga and meditation also have been looked as an intervention to bring in a change in your sleep architecture. Lifestyle is what we talk in integrative medicine. Probably one of the vertical of lifestyle is sleep. You can see these multiple different types of meditations put here, like Isha yoga meditation, Anapanasati meditation, cyclic meditation to others. But once again, you can clearly say that it reduces the time taken to fall asleep, number of hours slept increases, the quality of sleep improves, and the feeling of being rested in the morning goes up. So these are some of the proposed application. Whenever you do basic research, this is what it helps you to really look at. But when you bring all that into a clinical application, that's where you start having some kind of challenges, because integration is a bigger issue. Fundamental question is being asked when you talk of yoga: are multiple systems of medicine to be brought together? Is it one practice or many? Okay, somebody says that, okay, meditation or relaxation response is sufficient as part of yoga. Then I will bring in some panchakarma, and I can also add some physiotherapy, etc. Whatever you want to do it, you have multiple things to look at. And it is very important for you to see, is there enough evidence? Once again, in clinical research, 52% of publications come from non-communicable diseases. Okay, so out of which major chunk goes into either diabetes, cardiac health, and third one is cancer. This is one such example for you. A very old study done during 1980s, looking at the beneficial effects of yoga in the management bronchial asthma, published in British Medical Journal. Imagine we'll always look at publications and we want to publish them in best journals. If it is possible to publish in 1980s, it is very much possible to publish now. Only thing, you have to conduct studies with such rigor. Then only it can get into high impact factor journals. So this one study, very simple study published in British Medical Journal, demonstrated that yoga, breathing in particular, and yoga practices can facilitate multiple clinical outcomes. And also important factor, because this was an adjuvant, this as part of integrative clinical protocol. It has to be guided by a practitioner, a pulmonologist, to reduce the medication whenever you want to use yoga as a means to bring medication scores down. If it is a cardiology related project, then certainly you should have a cardiologist as part of it guiding the process. Nobody has any right to bring in changes in the established methodology, but final goal can be bringing a reduction in medication score, etc. Is it only to bring a change in the clinical outcomes? The modern medical system has become quite prominent today because it can bring in changes immediately. Blood sugar level is very high. Now I give a medication, immediately I can bring the blood sugar levels down. Similar attempt was made with yoga as an intervention. Yoga chair breathing was used as a tool to bring down acute asthma attacks. Probably we can bring in multiple techniques like this in future to demonstrate there is a possibility of bringing in quick changes. So you should always look at translation. So number of people who get benefited after a clinical research makes all the difference than doing the clinical research alone. So this has to be put into guidelines. This has to be promoted into policy making. Then only these benefits will reach the actual individual. Second area, as I was mentioning, was type 2 diabetes. I'm mentioning this purely because when you want to do integrative medical research, you cannot jump on to directly doing either a randomized control trial or level 3 clinical trial. So there is a need. For example, countries like India, we don't have prevalence studies at all. Okay, ICMR is the only agency which does lots of prevalence studies. We should not be sitting and waiting for somebody else to do this for us. So as major institutions and associations, we should take up these kind of studies, then conduct clinical trials to begin with feasibility, then efficacy, then do the proper randomized control trial. Most important is looking the underlying mechanisms, and multiple publications can be looked at. I'm giving one example for this to demonstrate this. This is tracking prevalence. So we have done a huge study whereby we have looked at 29 states, including union territories. And what we have done was looked at the prevalence. And then when we understood that the prevalence is increasing, we also did another pan-India study, which was once again looking at 240,000 individuals, including rural India, spanning across 65 districts of 29 states. Looking at individuals who have higher HbA1c. What you see on the right side is the trends. For example, earlier we used to see all these changes at around 60 to 65 years or 70 years. You can see these curves moving towards 40s. Okay, so this is what is alarming, what we can learn from such studies. So when you want to do a feasibility trial, when you look at a feasibility trial, we did it in collaboration with Nottingham University in UK, and this demonstrated that yes, you want to look at education as one of the important quotient to introduce yoga, and rural and semi-urban as another quotient to introduce. Is it really feasible to introduce yoga in these populations? And also, can we make it as a generalizable protocol? And certainly this study demonstrated that it is feasible. Lots of challenges were there which were reported as part of this study. And the third area is once again looking at how you can understand the mechanism. Can I work on mechanisms? So one of the major issue is like pre-diabetes individuals getting converted into diabetes. Can we bring, or can we put a clip to it or reverse it? So certainly there is, the insulin secretion itself is biphasic, as we know. And there is the first phase, okay, of insulin release, which gets affected even in pre-diabetes condition. And can we hit that point whereby we can reverse it or convert that not getting into a diabetes state? So when you can do that, this is the result of it, which demonstrates that yes, it is possible to convert or avoid people getting into pre-diabetes state. And if you want to go a little more into the depth of mechanism, certainly we have to learn it from modern medicine. We should not shy away. Take those same principles and try to implement in your integrative medical protocol. One of the study we did was on mitigation of DNA damage in type 2 diabetes individuals. And this shows very clearly that how you can reduce this DNA damage, and you can also help an individual. And this collective picture shows, based on our multiple studies, that you are hitting those areas which are very well established when you talk about type 2 diabetes, be it oxidative oxidative stress or DNA damage, or enhanced DNA repair, and what can subsequently facilitate in an area whereby we can help an individual to reverse his condition. Hence, we can say that yoga can probably be the best adjuvant. Cancer is the area where adjuvant yoga therapy is very well established today. So we have a couple of studies even going now in collaboration with MD Anderson Cancer Center, 3 NIH-funded projects, and at present, one study is going on, including a study on stem cell therapy in cancer management and using yoga as an adjuvant. We have looked at multiple things. So there was an R21 grant and R1 grant, and most of them were RCT trials looking at various indices of outcomes, looking at the impact of modern medical treatments, and also the post-operative outcomes. When you look at that, there are certain impact what yoga therapy can make on immune outcomes, as well as looking at the side effects of chemo and radiation. So, of course, the main goal is not just looking at the side effects, but also to look at quality of life. Can certain other symptoms like fatigue, etc., can be manipulated, and can we bring in a change, including the stress impact on oncology, on patients with oncology. So this was one of the main study where we looked at how this whole process can be studied much more in detail, and ended up with this study looking at the impact of yoga therapy on side effects like nausea, emesis in breast cancer patients, etc. For most of these mechanisms, we have evidence today to talk about integration of yoga along with modern medicine can bring in a change at different levels, what you can see here. So I'm not going to this particular part, but I want to end with the pain management aspect of it, because integrative medicine is one of the amazing tools in pain management. We have picked migraine as one of the areas, and this is where we looked at integration with Ayurveda on one side and modern medical approach on the other side, with whatever medication prescribed by the neurologist for these individuals. When we looked at the disability, various symptoms, perceived stress, and autonomic and electromyogram, it was very clear to demonstrate that the quality of life can improve significantly, covering various domains in it. Symptomatology can change positively. And of course, migraine disability can reduce compared to day 30 and day 90, as well as the overall stress response as measured by heart rate variability, demonstrating positive changes. And of course, we have also done surface EMG looking at the frontalis muscle, which demonstrated that you can reduce that impact. Once again, as I spoke about cancer, once again here in this, we have a very well-known mechanism, okay? Particularly, there is cortical depression, whatever has been very well described in migraine management, can be manipulated both with yoga and Ayurveda in combination. I have mentioned the mechanism over here, which each one of them are based on a scientific study. Once again, similar to that is your elderly, where it is much easier to integrate because these are the areas where you have scope. Okay, so rehabilitation is one area you have much bigger scope for integration. And we have looked at gait and balance, once again demonstrating positive impact. Depression in this, I have added a slide just to demonstrate not just any specific form of yoga. There are multiple studies, some looking at socialization through yoga, bringing dynamic practices through yoga, Bhakti Yoga, which is Kirtan Yoga in the West, and also philosophy of yoga, which all of them can contribute, and each one come from different yoga techniques, kind of it. And of course, sleep in the elderly. And very important that can you really bring in, make this as self-oriented activity in yoga, naturopathy, Ayurveda. we talk about healing by thyself. Okay, we can facilitate the process, but the healing has to happen within an individual. Is it really possible? For that, we did this one interesting study in Antarctica. So this study looked at the typical stress response, whatever happens in Antarctica, social, physical, as well as climate related, all that on various dimensions like stress-related biomarkers, global gene expression, telomere length, as well as quality of change. So this particular study looked at the contingency of researchers who go to Antarctica. Every year, there are two durations. One is a summer expedition, another is a winter expedition. This is the kind of climate what you see. This is the summer expedition team which went, and we had our representation. We have planned this whole study to be conducted in these two labs in Antarctica. One is Maitri and Bharati. And this study was done in collaboration with the Defense Research Development Organization, particularly DIPAS, Defense Institute of Physiology and Allied Sciences. What we did was we developed protocols first, yoga-based protocols, two of them, one for seasickness because they travel for 1.5 months, and second one for Antarctica stay. This is for the first time yoga was practiced on the glacier of Antarctica. And this was so interesting to look at the issues associated, but at the same time, how yoga has facilitated. This is just a glimpse for you. Can we really bring in a major change which an individual can provoke it? So what we call it as conscious intelligence in you getting ignited through this practice. So these are some of the fantastic results, all of them talking about a reverse of stress response and bringing in relaxation response. And this is talking about the global gene expression. And in the center, what you can see, yoga acting as a master regulator. And what happens is we saw there is a lot of chaos in global gene expression in the control group. But when you look at yoga group, there was an organized chaos. I don't say that there was no chaos in gene expression, but there was an organized chaos. This also talks about this whole process of what we have looked at. But I would like to just say that you give an opportunity for your body, it will certainly understand which buttons to press. And that's what these combination, the marriage of traditional medicine and modern medicine can do. So let me give you some take-home messages. Certainly, when you talk of integrative medicine research, what is needed is to look into the research designs little beyond RCTs. Whenever I talk about RCTs, don't think that we are eliminating RCTs. Try to see how best we can design RCTs for integrative medical research. So the tweaking can be done only by us. If we keep blaming that, no, we can't do RCTs, then we will be the people who are left out. Then certainly there are other advantages of single case experimental design too, etc. And particularly we have picked a new design in recent times for clinical research. It is this single case experimental design, SCED design. So this looks at repeated measures. The sample size can be smaller, but you study an individual multiple times for maybe 1 year or 2 years or 3 years. That is equally acceptable, though the sample size is smaller. So we can demonstrate the beneficial effects looking at the preventive healthcare strategy, integral part of yoga as a positive lifestyle modification strategy. And we can also bring out the customizable yoga therapy modules, particularly looking at frequency and duration. Unfortunate that we have a fixation that yoga has to be practiced 1 hour per day. I mean, I have looked at it so much in depth. Truly speaking, looking at ancient yoga scriptures on one side and the evidence on the other side, it has to be customized. Somebody probably requires, if your condition is very serious, 3 hours of practice, okay? While somebody else can manage with 30 minutes of practice. Don't generalize it, though there is an average duration which has been picked. And also customize yoga therapy for the requirement. Unfortunate, there are more and more systematic reviews and meta-analysis coming rather than original research articles. There is a need for more and more people to do original research and publish either any of those 4 verticals I was talking about. And of course, the intervention, whatever we design, it has to be country and culture specific. I cannot bring the same methodology of intervention, what I practice in India, to another country, while I hold on to the basic tenets of yoga therapy. I don't dilute the fundamental principles, but design it in such a way which is useful. And of course, it will also help us to get back to those classical yoga texts, and which probably can give us idea about unraveling some hidden secrets of health and longevity. So the future is integrative medicine. Let us not have any doubt about it. Just a word of caution I wanted to mention. Why integrative medicine is not picking as fast as we expect? Fundamentally, there are certain issues like identity crisis. Each system of medicine representatives have their own identity crisis. Now, if I want to add yoga to with major Ayurveda as an intervention, naturopathy as an intervention, or modern medicine as intervention, I will have my own reservations in it. So probably if I drop that identity crisis, small or big, let me contribute to the beneficial effects of a patient, then I will contribute in a bigger way. We all should remember our vote taking during our medical graduation, okay? Any system of medicine for that matter. We say that I will work for the benefit of a patient. Making an individual healthy is my goal. How I do it, whether I do it, I take the help of somebody, this is all as part of this vote taking. I think we need to just get back there. We need certainly research as well as publications. Many clinical practitioners, they don't document. And even though some of them document, they don't publish. Whichever way it is possible. I mean, this is where I want to acknowledge AAYM and the efforts of Dr. Indranil Basure, who is bringing in multiple programs, including research methodology, short-term programs as well as long-term programs for everyone to understand. You may be sitting in a small clinic, but how do you document your information? And there is also methodology what Dr. Basure has developed to help individuals to publish this information. So probably this is the way forward for all of us. And we have a tendency of talking about challenges, but not converting those challenges into opportunities. And we all know very well that health is the primary requirement. Okay, so we know dharma, artha, kama, mokshanam, arogyam, moolamuttamam. Without that health, we cannot do anything. And probably that's what is most essential. List of total number of publications, out of which S. Vyasa has these many. And I credit these publications to all these people. I have not added one person. I knew that this person will be on the screen, who is Dr. Indranil Basure. Forget about working with S. Vyasa. He is one such network which he is bringing so many institutions together. And all the people, those who are here, represent different institutions. Some of them are S. Vyasa. Some of the publications I have referred in this come from them. But credit goes to so many institutions across the world who are doing research and promoting integrative medicine, because of which we are all sitting and talking about integrative medicine here today. Thank you very much, Dr. Basure, and the whole team for giving me this opportunity to bring in some of my small-term experiential knowledge to share with everyone. Namaste.
Thank you, Manjunath ji. That was an excellent talk. I mean, it is unbelievable. So many things to take away. Let me ask you one question, because that has always got me involved. You're right. Since I've been practicing meditation since 6 years of age under a very powerful system in India, meditation, as you know, consciousness, we really know nothing. Even Western media knows really nothing. And I don't want to name some institution, but some of the biggest institutions in India, unfortunately, have also been using old techniques like ECGs, EEG, actually used a 3 Tesla magnet. So what do we need to do so that I think in the next 10 years, consciousness meditation will get us more than one Nobel Prize. Whoever does it, it doesn't matter whether it's sitting in India, America, Antarctica, because we are you wanted to take a voyage in the ocean, but you're still sitting in the beach. As Ramakrishna said, I wanted to walk through the ocean, but I'm sitting and still counting pebbles on the beach. So, what is your thoughts? What is lacking? I mean, between institutions, we have so much resources. Why can't we bring them all? Because the work I know from, say, Indian Institute of Science and other places, nothing, I mean, they're still very primitive, what I call still in the dinosaur era. So, what needs to be done with your experience as a person who does bench research, as a person who's the vice chancellor of the university, as a person who advises Prime Minister Modi and the entire government of India? How can we bring these resources together? Because, and correct me if I'm wrong, my thought process is India does not lack resources. India lacks that communication that will bring all these resources together to get the results. As you correctly said, you might be sitting in a small clinic. And that's what I learned in my training. You may be seeing a simple patient, but that simple patient itself can create research topic. What is the lacune? What is the problem that we are facing? Why this is happening?
You are right, Dr. Basure. See, there is no dearth of infrastructure, be it in India or outside India. What we lack is shedding away our ego and collaborating. Okay, so that is one of the aspects I see. Number two is certainly the knowledge base. Okay, see, for example, if I have a machine in my lab, I do all the research using only that one machine, whether it is in patients, whether it is in healthy individuals or in somebody else. And I design or I make my hypothesis only on that machine. Okay, so it's okay when it was 90s. Okay, but now there is so much of infrastructure available. We need to collaborate. We need to talk to each other. We need to really come out of our shell, and we have to really expect and move forward to say that I want to learn. I want to contribute, but before that, I want to learn. If we can start promoting this approach, then probably utilization of infrastructure goes up. I don't want to name any institutions once again. So many institutions with lot of infrastructure. The utility of it for research purposes is reasonably less. Okay, whereas in the West, there is fantastic weightage given to research. In a hospital, if you have a 3 Tesla mission, I mean, I was so fascinated. I was in Geneva. We are doing some research on meditation with University of Geneva as well as EPFL labs. There is a 7 Tesla mission. And of course, the research is very so well integrated. I mean, they don't do an EEG study anymore. They do an integrated EEG and fMRI study. So now they want to understand the mechanisms, what the electrophysiology as well as cortical blood flow changes can probably talk about. So that's the direction the whole world is moving. So if we just end up sitting and doing EEG studies on meditation, then we are left out. World is moving forward. So second thing is get connected. Okay, for example, you are doing this lecture series. How many of our youngsters or anybody make the best use of it? You are bringing so many experts from across the world, and the hunger to know, hunger to collaborate Imagine you have brought in somebody, and every participant in this lecture series has an equal opportunity to get connected with that person. Okay, so that's the way you can progress. Imagine just with as an offshoot of this lecture series, some institution sitting in remote corner of south of India can get connected with an individual doing research on meditation at UCLA. This is what is needed. I think whenever I travel in US, when I visit multiple institutions in US or in UK or in China, people are very warm. Okay, they are welcoming, and only thing is we have to really approach and say that I want to really do a collaborative research, but for which I have to be prepared. Like I cannot have a desire to do without preparation, without doing the homework. Do some small little studies to begin with, and take help of experts who are volunteering to help like this, and then you reach a level whereby you can gradually enter into the elite category of doing research. Nobel Prize is definitely there. You are right, and no doubts about it. But who gets it determines the efforts behind it about doing all that research.
Thank you, Dr. Manjunath ji. Dr.
Um, yeah, so hello, sir. Thank you very much, sir, for the always blockbuster picture you present whenever you present. We are at awe. And like, sir, there are one question from one of our participants, like, no, while research shows the positive effects of yoga, how was the mechanism of which yoga produces these effects discovered? Even to add to that particular question, I also have that same thing. Now, when you look into the PubMed or any database, there are a lot of studies speaking about the impact of yoga on so many symptoms of diseases. But seldom it speaks about the mechanism, or even the discussion part covers the data from the review articles, not a mechanistic study being conducted. So how you judge, or you being a seasoned yoga researcher, what is your take on that? Sir, you're muted. Sir, you're in mute.
Yeah, very good question. I meant, because what happens, no? Everyone, those who publish, they have been trained to publish. Okay. So particularly everyone takes up a small research area and they conduct a study. So now when you talk of underlying mechanisms, that should have been your hypothesis to study. If you have not studied that, you can never bring those components into your discussion. So what people do, all those general aspects of physiology, like the commonest thing is heart rate variability. Okay. Second commonest is symptomatology associated with a clinical condition. So people pick those kind of areas for research because that is much easier to study and publish. Number of articles looking at underlying mechanisms, okay, are really small. Even though there are a few articles, like we were interested to look at global gene expression in individuals in Antarctica and doing Antarctica expedition. But when we did that, we understood that probably if you go with an existing hypothesis, you are going to miss out something. So be open in understanding these mechanisms well. There is a gene called keratin gene, which people have believed that this has extincted because we are all living in environments like this, air conditioned. Keratin gene actually regulates your skin and hair growth. So people, when they were living in challenging environments in jungle, so this gene expression used to be very strong. But when people practiced yoga in Antarctica, the keratin gene expression went up by 300%. So now imagine if I would have picked a metabolic pathway of gene expression, I would have missed this. So when you really want to pick underlying mechanisms, do enough homework. Okay, so one is existing literature. Second thing is you create your own channel for understanding new mechanisms. So that's when you contribute. Nobel Prize is given for those who come out with these new mechanisms, because otherwise each one is working on an existing mechanism. Discussion part of it always is just to support your claims. Majority of the people, unfortunately, pick those articles just to support their claims, but not talk about the underlying mechanism. This is a limitation. For sure, this is a limitation, but there are such fantastic publications. People should read those publications where you get a insight of getting into underlying mechanisms and explaining them. Not necessarily you have to really do those studies, but at least many of these mechanisms are available in your textbooks, okay? Or it is available in some of the meta-analysis studies. But only thing, you have to really open it up and explain it to people the way they can understand. Otherwise, it's just linking references and just creating a story narrative. That's not going to help. I totally agree that we need more and more studies on underlying mechanisms, and probably that's going to give a better direction for us.
Okay. Yes, sir. So then one personal question of mine, like when we decided this topic for you, what has been going in our team's mind is like, so we have been doing yoga research, and you being one of the lead runner in yoga, collaborating with a lot of international institutes. But still, if you see the kind of studies what we do or across the globe, yoga is always used as an adjunct treatment, either to modulate certain thing. Like if you see the Dr. Prabhakaran was speaking on the other day. So they are using on some components of cardiovascular disease or some components of cancer. And on the other side, other part of the world, you have been producing studies which yoga can actually work on the pathology, on the cycles where it induces the disease. So what is that limitation when you talk to the different stream of people, and what is that limit them to put it there, like how you say, like how a metformin works in the similar way, this also has some role in some pathways. So what is that limitation you face and how to overcome that in futures?
See, if you ask me, most of the traditional medicine practices, including yoga therapy, be it Ayurveda, naturopathy, yoga, etc., there is a fantastic positioning for them under preventive healthcare strategy. I don't know why we don't give importance to it. You can remain healthy. You don't need to get sick and then become all right. But at the same time, we cannot say that, okay, all those who are sick, now you manage with something else. With our modalities, we will maintain only healthy individuals to remain healthy. Swastasya swastha rakshanam. So now what happens when you take clinical population, those who are already having some derangements, other systems will have some limitations to jump into the modalities of treatment and reversibility, because we don't know how exactly it can bring in a change when it is deranged. Otherwise, the philosophy part of yoga talks, the pathogenesis of a disease we know very well. We say that adija vyadi, okay? So mind is the root cause we talk. So we can probably say that, no, you don't need to use yoga as an adjuvant. You can use yoga with confidence that yoga can probably be the mainstream medicine. There are areas where you can use yoga as the standalone therapy. Okay. See, in most of the cases, even diabetes for that matter, we have seen n number of individuals reversing their diabetes to normalcy. Now, the challenge is, can you sustain it? Sustainability is possible through yoga. Sustainability is possible through yoga-based lifestyle. Okay, so we can definitely say that yoga-based lifestyle can be used as a standalone therapy. There is no problem in saying that. But when there is a health condition, like there is a disease condition, the priority is to preserve further damage, number one. Number two, to ensure that the person, at least I maintain the condition. So there is an established line of treatment where the ethical considerations come and they say that, okay, don't disturb this at least. You can do good, but don't cause any harm. So that is the only reason why we are not in a position to say that occasions we can use yoga or any other system of medicine as a standalone. But let us say there is a naturopathy hospital, there is a Ayurveda hospital. People go there, they take only Ayurveda, they take only naturopathy, still they become better. But what is needed for us to go to mainstream medicine to say that, yes, I have an experience here, I want to bring it into a clinical setting like yours, I need to document and demonstrate. Not always we need to use these systems as an adjuvant, but there is a strong direct implication that we can use it as an adjuvant.
Yes. So thank you, sir. Thank you very much, sir. We know how 90 minutes of yours is precious given the kind of schedule you have. And I am very sure that our entire participants will be enlightened with the kind of thought process. Even I was wondering, every time how you are producing these kind of slides. We just come to learn and can copy some of that in our presentations later. So we always come with that selfish attitude to your lectures. And thank you very much, sir, for accepting our invitation and being a part of this particular thing, and looking forward to collaborate with you in future as well. And for all the participants, we are also coming up with a 6 months fellowship program in advanced biomedical research as well as statistics, where we'll be discussing about almost all the methodologies what Dr. Manjunath has been giving. And tomorrow we have the entrance exam by 7 to 8 p.m. It's an online thing. Already around 65 people have registered for that, and still you have time to register. And we will be offering fellowships that sponsor fellowships for around 3 students who come in the top. And also adding to this, on Monday, we'll be having another one lecture from Dr. Muvendan, my colleague and also a student of Dr. Manjunath. So of course, we all are his students. And we are very proud of Dr. Muvendan. He's among the 2% scientists list, which is released by Stanford University. So that is something he'll be speaking on, how to write impactful review. And in naturopathy, he's the one guy who had the highest number of citations for a narrative review. So I just want him to speak on how you can write an impactful review, and that will be on Monday. So stay tuned, and I all want you to write the entrance exam tomorrow and secure scholarships for getting into the fellowship program. And once again, thank you, Manjunath sir, for your kind gesture of accepting our invitation.
Thank you.
Thank
Thank you,
you.
Manjunathji.
Thank you, Indranilji. Thank you, Pradeep, and the whole team of AAYM for this wonderful series. Namaste.
Namaste. Thank you, sir, for making time for us.